This is a before and after of a breast augmentation with a peri-areolar lift. And that means the incision is just around the areola, as opposed to sometimes you'll hear people talk about an anchor incision or a wise pattern incision, which is the full incision where you have an incision around the areola, one towards the fold and one along the fold. But this one is just a circular incision around the areola. And the reason I think this is such a great case or patient to talk about is if you look at her before and after, it's a small amount of augmentation and a small amount of lift, but we have a wide variety of options. Say someone comes in and they're thinking, okay, I want to do a breast augmentation. They're not really thinking they need a lift because their nipple looks like it's in a good position to begin with for the size that they're at. But if we're putting implants behind the muscle and the breast tissue is sitting a little bit lower, it can look kind of disjointed after because we want everything to sit together. And so one thing we could do is do a full lift and have the implants behind the muscle. And then everything is kind of higher on the chest, more perky and together. And over time, that ages really well. But a lot of patients don't want those scars and they'd rather sacrifice a little bit of change in shape to not have the scars. And in this case, she wanted a very natural result. She didn't want them super high, didn't want a lot of fullness up top. So for her, it made more sense to do just a small lift. So it's bringing that lower tissue up a little bit and a small volume augmentation. In case anyone's curious, these implants are 255 cc implants and they're placed behind the muscle, and the lift is a peri-areolar lift.